So we'll just go through some of the important topics in hospital administration. Okay, exam briefing is also has been done. It's the same for the hospital administration as well. Okay, so just a moment. So in chapter 10, that is your legal aspects of hospital administration. I think in the new textbook also it is the same chapter. Okay, legal administration, legal aspects, page 52. What is law? What is ethics? Okay, code of medical ethics. There are explanation to all the codes of medical ethics, some definitions. What is law of torts? Okay, just these things. Read what we have done in the class as well. Just if you go through that, what are the different code of medical ethics? Those are important. Okay, if you have the knowledge of that, some conceptual questions can come from it. Okay. Then chapter 13, planning. All types of planning. Okay. There is a hierarchy of the plan. A picture has been shown. A hierarchy of plan. Okay. From the vision mission statement up till the budget. Okay. Those all come under the hierarchy of plan. So that is important. All different types of planning. The steps in planning. Okay. Uh, what is MPO? Management by objectives, the process of MBO, benefits of it, okay, limitations of it. So those are the important topics from planning. In chapter 14, decision making, page 72. Okay, these few page numbers are the old ones. In decision making, page 72 onwards, or what are the different types of decision? The one that you take on a daily basis, routine decisions. Okay, programmed, non-programmed decisions. Okay, that is important. And steps in decision making, factors influencing decision, very important from a perspective of an individual. Okay, what is PERT? What program evaluation and review technique? Just the brief of it. Okay, how it is explained, that is more than enough. Not the stepwise how do you do it. Okay, job designing, all topics in job designing is important. It's a 2-page chapter. Okay, that entire thing is important. Job enrichment, job enlargement. Then directing, all topics as well. Motivation, what is the formula of motivation? Okay. Then leadership, the different types of leaders. What is leadership? What is authority? Okay. What is power? What is authority? The difference between that, different types of leadership. Then in hospital planning chapter, it's a big chapter. Okay, so under that, with the definition of hospital, just go through it. Okay, what are the aims of hospital planning? Page number 163. Okay, factors affecting the utilization of hospital services, usually the demographic factors. Okay, what affects why the people choose or the community choose a particular hospital. Okay, so those are important. Hospital planning process is a big area. Okay, from entire planning process step by step. It's a big process. So even under that, the main steps, the meaning of it, what is explained in the class, that is more than enough. Okay. Hospital project management, important. Different types of hospital. Okay. Next is outpatient department services. Now coming to the clinical services. What are the types of outpatient department? Okay, importance of outpatient department. Why outpatient department is used? What are the functions of them? Okay, what physical facilities do you provide in a regular outpatient department? The layout, equipment, staffing, policies, procedure. Okay, these things will come under it. And emergency services as well, all topics. That's an important chapter. Okay, what are required facilities, equipments, okay, the different types of emergency services based on the type of hospital it is given. Okay, primary, secondary, tertiary. So just go through that. Then we have the inpatient department services, IPD, from 205 page number onwards. Okay, what is inpatient department? How do you plan and design a ward? Different types of IPD ward. Okay, Florence Nightingale ward, Riggs pattern ward, T-shaped, E-shaped. Okay, that is important. Location. Okay, interdepartmental relationship between wards. Circulation of the inpatient department. Size of the inpatient department. Okay. Different forms of ward, special wards, staffing, and then in personal management, just about the nurses, read about nursing services, managerial issues from this chapter. Okay. Then we have the OT, operation theater. All topics are important. Physical facilities, engineering, okay, policies and procedures, monitoring the operation and asepsis in the OT. Okay, all these are important. Then ICU, different types of ICU. What is an ICU? What physical facilities do you give? Okay, where it should be located? What is the staffing? What kind of equipments? Okay, monitoring, diagnostic, therapeutic. Okay, there are different types of categories of equipments. Then you have the diagnostic and therapeutic services. Those in those session, your laboratory services, the different types of laboratory services, quality assurance, quality control, quality assurance. Okay, different quality control techniques used in laboratory. Then radiology, 276 to 282, that is the old book, but in new textbook, page numbers have changed. Okay, so don't get mixed with page numbers. It's 252 in your new textbook. So again, in radiology, what are the different aspects of radiology? Okay, diagnostic, therapeutic. Okay, under that, what are different types of equipments used in radiology? Okay, chest, abdominal, interventional, musculoskeletal, pediatric, mammography, nuclear medicine, types of services. Okay, physical facilities available for radiology, administrative area, general area, storage area, those all things, staffing. Then for specific equipments, if you're keeping a ultrasonography, okay, machine, what is required. For CT scan, what is required, how much area is required. MRI machine, how much area is required. Mammography room, what is required. Okay, so that is important. Policies and procedures, and in radiotherapy as well, where it should be located. Staffing, policies and procedures, managerial issues. Okay. Then you have the blood transfusion services. So what is blood transfusion? The definition of that: physical facilities available in the transfusion area. Okay, who are allowed to transfuse blood, you donate blood, who are barred from donating blood, what is a temporary debarment, and what is a permanent debarment. Okay, in which conditions, which cases. Okay, so learn that. Different facility, again the different facilities, how many areas they will have. Okay, what equipments are used, just read through it, no need to by heart the equipments from the transfusion area. Okay, what kind of test is done for donor blood to make sure it is safe for the users. How do you issue the blood. Okay, quality assurance system, just read through it. Then in the MRD, all topics are important. Medical records department, where it is located. Okay, what is the use of medical records, how, what is the retention of medical records. Okay, how do you store them, the different procedures that is followed in MRD. Okay, from coding onwards, indexing, storage and all. And the managerial issues that you face in aspects that you face in MRD. CSSD, page 287 onwards. What is the CSSD? Okay. What is the role of CSSD, aims and objectives, physical location, where it is located, the staffing, how it is done, what different kind of instruments are used in CSSD, sterilizers and all. How do you operate in the CSSD? That steps from rinsing, cleaning, drying, inspection, and so on, labeling and all. Okay. Policies and procedures. Then you have housekeeping services. All topics are important. Housekeeping. 304, page number. The abbreviation of police and all. Okay. Police task and these things is come under housekeeping. 5S technique. Okay. What are the qualities of a good housekeeper? Good cleansing agent. Okay. Different types of housekeeping. Main functions under housekeeping. Cleaning agents used. Recent trends in housekeeping. Okay, the 5S technique, the full form of it, what is done in 5S techniques. Then transportation system, 310, page number. What is hospital transportation? What are the different types of transportation, intramural, extramural? What are the different types of vehicles used? Okay, helicopters, helicopter and ambulance, air ambulance, train ambulance, CATs, okay, motor vehicle ambulance. So what are them? With pictures we have shown in the classes. Okay, just go through that. What facilities should the hospital have to have an ambulance parking? What equipments will the ambulance have within itself? Okay, a general ambulance as well as a advanced life care ambulance. Okay, how many doctors and nurses should there be there? Waste management, all topics are important. Okay, the entire chapter is important. Different types of waste management techniques. Color coding, different types of waste. How do you dispose them? Okay. Occupational safety as well, all topics. Okay, all types of occupational safety, you should know what at least 2 solutions that you can bring about for it. And quality in healthcare as well. What is quality? Definition of quality. Okay, different accreditations and all. Media, just read through it. Chapter of media, the 5 F's of media. Okay, different types of media outlets, stringers, reporters, editors. What is the different terminologies used in media? How to create a press kit for media. Okay, how to manage the relationship with media. Telemedicine, when did it start? Okay, how can it be useful? What is the effects of having telemedicine, advantages of having telemedicine? Then medical tourism, just read through it. Okay, which areas receive the in which specialties receive the major medical tourism? Okay, pros and cons of it. What are the factors that increase the medical tourism in a country? Then section 9, just appendix 1, appendix 5 and 6. Okay, just read through it. That's it. Much questions won't be asked. Just 2 sample questions regarding hospital administration. For example, biomedical waste should not be stored beyond 48 hours. If you read the textbook, it is mentioned within 48 hours, you have to dispose the biomedical waste. Okay, 3 options are given and question. You have to select the option, click submit. Then the next question will come. Okay, that's how the link works. Exam link works. You will not be able to see all the 50 questions at once. You have to answer one question, submit it, then the next question will pop up. Okay. Recommended number of ambulances under Rao committee for 150 bedded hospital. Okay. What are the recommended numbers? So it's like for every 50 beds, you should have 1 ambulance. Okay. So if it is a 150 bedded hospital, at least 3 ambulance the hospital should have. So this is what the Rao committee has given. Okay. This is the strategy what you have to apply for uh, realizing how much ambulance a hospital requires. Okay. So these are just 2 sample questions. You can understand what kind of questions will be formulated from other chapters as well. Okay. Some factual and conceptual questions. So is it clear to all? Students of hospital administration, is it clear to all regarding what kind of questions will come?